Welcome back. Today, we'll be talking about an important topic, gonorrhea. We'll delve into what it is, how it's transmitted, its symptoms, treatment options, and most importantly, how to prevent it. So, let's get started. What is gonorrhea? Gonorrhea is a sexually transmitted infection, STI, caused by the bacterium Neisseria gonorrhoeae. It primarily affects the genital, rectal, and throat areas and can lead to symptoms such as painful urination, discharge, and, in some cases, can cause serious health complications if left untreated. Brief history of gonorrhea. Early understanding. Historically, the cause of gonorrhea was not well understood, and it was often confused with other genital infections. It wasn't until the late 19th century that the bacterium Neisseria gonorrhoeae, responsible for the infection, was identified by the German physician Albert Neisser. Pre-antibiotic era. Prior to the discovery of antibiotics in the mid-20th century, gonorrhea was challenging to treat, and it often led to severe complications. The development of penicillin marked a significant advancement in the treatment of the infection. Antibiotic resistance. In recent decades, antibiotic resistance has become a growing concern in the management of gonorrhea. The bacterium has developed resistance to multiple antibiotics, making treatment more challenging. Ongoing research in the development of new treatment approaches are essential in managing this sexually transmitted infection. About causal agent of gonorrhea. Shape. Neisseria gonorrhoeae is a gram-negative bacterium, and it has a characteristic shape known as cocci. These are spherical or round cells. Size. These bacteria are typically small, measuring about 0.6 to 1.0 micrometers in diameter. Arrangement. Neisseria gonorrhoeae cells are usually found in pairs, which is referred to as diplococci. They appear as two adjacent cocci with their flat sides facing each other. Capsule. This bacterium can have a capsule, which is a protective outer layer that aids in its virulence and resistance to the immune system. Fimbriae. Neisseria gonorrhoeae has fine, hair-like structures called fimbriae on its surface. These fimbriae help the bacterium attach to and invade the host's mucosal cells, contributing to its ability to cause infections in the genital, rectal, and throat areas. Cell wall. The cell wall of Neisseria gonorrhoeae, like other gram-negative bacteria, consists of an outer membrane and a peptidoglycan layer. How gonorrhea is transmitted. Gonorrhea is primarily transmitted through sexual contact with an infected person. It is considered a sexually transmitted infection, STI, or sexually transmitted disease, STD. Here's how gonorrhea is typically transmitted. Unprotected sexual contact. The most common mode of transmission is through vaginal, anal, or oral sex with an infected person. If a person's genital, anal, or oral mucous membranes come into contact with the bacterium Neisseria gonorrhoeae, which causes gonorrhea, they can become infected. Infected partners. Having sexual contact with a partner who has gonorrhea increases the risk of transmission. Even if an infected person doesn't display symptoms, they can still pass the infection to their sexual partner. Mother-to-child transmission. In rare cases, gonorrhea can be transmitted from an infected mother to her newborn during childbirth. This can lead to eye infections in the baby, which, if left untreated, can cause vision problems. How Neisseria gonorrhoeae causes disease, pathogenicity in human. Attachment and invasion. Neisseria gonorrhoeae possesses fine, hair-like structures called fimbriae on its surface. These fimbriae help the bacterium attach to and invade mucous membranes in the genital, anal, and throat areas. Host cell invasion. Once attached, Neisseria gonorrhoeae can enter host cells. It uses several strategies to penetrate the host cell, including the production of enzymes that break down host cell barriers, allowing the bacterium to enter the cell. Inflammation. The infection triggers an inflammatory response in the host, leading to symptoms such as pain, swelling, and discharge. The inflammation is a result of the body's immune system trying to combat the infection. Antibiotic resistance. Neisseria gonorrhoeae has developed resistance to various antibiotics, making treatment more challenging. What are the symptoms of gonorrhea? For men, painful urination, discomfort or a burning sensation when urinating. Penile discharge, white, yellow, or green discharge from the penis. Swollen or tender testicles. In some cases, inflammation and pain in the testicles may occur. For women, painful urination. Similar to men, women may experience discomfort or a burning sensation when urinating. Increased vaginal discharge. Unusual vaginal discharge that may be yellow or greenish in color. Abdominal pain. Lower abdominal pain or pelvic pain. Painful intercourse. Pain or discomfort during sexual intercourse. Irregular menstrual bleeding. Gonorrhea can cause changes in the menstrual cycle. Complications. If left untreated, gonorrhea can lead to serious complications. In women, it can cause pelvic inflammatory disease, PID, which can result in infertility and chronic pelvic pain. In both men and women, Untreated gonorrhea can increase the risk of contracting or transmitting other sexually transmitted infections. It can also be transmitted from mother to child during childbirth, potentially leading to eye infections in newborns. How to diagnose gonorrhea? Nucleic acid amplification tests, NAATs, are the most common and reliable tests for gonorrhea. They detect the genetic material, DNA or RNA, of the Neisseria gonorrhoeae bacterium. These tests can be performed on urine samples, swabs from the genitals, urethra, cervix, or throat, or swabs from the rectum. Culture. In some cases, a culture test may be used. This involves collecting a sample from the infected area and growing the bacteria in petri plates containing suitable growth media. Cultures are less common because they require more time and specialized conditions but can help determine antibiotic sensitivity, which is crucial due to rising antibiotic resistance. Gram stain. A gram stain may be used to identify Neisseria gonorrhoeae under a microscope, but this method is less sensitive and specific than NAATs in cultures. Molecular tests. Polymerase chain reaction, PCR, and transcription-mediated amplification, TMA, tests are highly sensitive molecular methods used to detect the genetic material of the bacteria. What is the treatment for gonorrhea? The treatment for gonorrhea involves antibiotics to eliminate the Neisseria gonorrhoeae bacterium responsible for the infection. Commonly used antibiotics for gonorrhea treatment include ceftriaxone. This is typically given as an intramuscular injection, a shot, in combination with oral azithromycin. Azithromycin. This is an oral antibiotic taken as a single dose, often in combination with ceftriaxone. It is used to treat co-infections with chlamydia, which often occur alongside gonorrhea. It's essential to complete the full course of antibiotics as prescribed by a healthcare provider, even if symptoms improve before the medication is finished. This helps ensure the complete eradication of the bacteria and reduces the risk of antibiotic resistance. How to prevent gonorrhea? Abstinence. The most effective way to avoid gonorrhea and other STIs is to abstain from sexual activity. This means refraining from vaginal, anal, and oral sex, if symptoms of gonorrhea suspected within you or your partner. Mutual monogamy. Engaging in sexual activity within a mutually monogamous relationship with a partner who has been tested and confirmed as STI-free can reduce the risk of infection. Condom use. Consistently and correctly using latex or polyurethane condoms during sexual activity can significantly reduce the risk of gonorrhea and other STIs. Condoms create a barrier that prevents direct contact with infected bodily fluids. Dental dams. For oral sex, using a dental dam or a cut-open condom can provide protection. Regular testing. If you are sexually active and have multiple partners, regular testing for gonorrhea and other STIs is crucial. Early detection can lead to prompt treatment and prevent the spread of the infection. Vaccination. While there is no vaccine specifically for gonorrhea, getting vaccinated against other STIs, such as human papillomavirus, HPV, and hepatitis B, can reduce the overall risk of STIs. Open communication. Communicate openly with your sexual partners about your sexual health history and any potential risks. Encourage your partners to get tested regularly as well. Avoid high-risk behaviors. Avoid engaging in high-risk sexual behaviors, such as having multiple sexual partners without protection or having sex under the influence of drugs or alcohol. These behaviors can increase the risk of STIs. Protection for mother and baby. Pregnant women with gonorrhea can transmit the infection to their newborns during childbirth. Prenatal care and appropriate medical management can help prevent transmission. Education. Educate yourself about STIs, their transmission, and preventive measures. Knowledge is a powerful tool in protecting yourself and your sexual partners. Conclusion. Gonorrhea is a common sexually transmitted infection that can have serious consequences if left untreated. Remember, it's essential to prioritize safe sex, get tested regularly, and seek medical advice if you suspect you have gonorrhea. Prevention is key to maintaining your sexual health. That's it for today's video on gonorrhea. We hope you found this information helpful and informative. Don't forget to subscribe to our channel and hit that notification bell so you never miss an update. Thanks for watching, and stay healthy.